My name is Iain Miller. I'm born and raised in Alaska. Um, I completed my undergrad at the University of Alaska and have been working on some graduate studies since then with a focus on rural Arctic health issues. And particularly as of late, kind of gotten drawn into quite a bit of the COVID response in rural Alaska. I think it's a very diverse way of, Alaska being very diverse. So even within the last few days, we've seen very marked increases in case numbers. But in particular to my observations being in rural and Western Alaska, I think we can fairly say that there is a very big disparity in levels of concern. So by that I mean, I think from my observations, most places in Western Alaska are very conscientious of the challenges that the virus faces and the health disparities that go along with that as far as treatment and staffing for handling the disease. And then in the urban settings, I think we're facing many of the challenges that most of the rest of the United States is facing with regards to compliance and following with recommendations that are set forth by public health, and which unfortunately has led to some very large case counts by certainly by our standards, numerous 500 plus case days over the last couple of weeks, and definitely raises the level of concern quite a bit. I won't claim to be an expert on all things related to Alaska Indigenous challenges, but from my own observations in a handful of different regions in Western Alaska over the last, let's say 6 months, whether it be the Cotsby region or the Nome region or the Yukon-Kuskokwim region, I think it's a fair assessment to say that many of the hubs are being very wary of outside travelers at the moment, and trying to be, even within the region, very conscious of trying to limit inter-village travel as much as possible. That's led as far as there's a handful of communities that are going on several months of being truly locked down, where there are not visitors coming in and out. You really have to have a very explicit rationale for why you have to leave the community, and I think that's leading to a lot of other challenges. I think Western Alaska already has very high rates of mental health concerns and suicide and substance abuse, and I think we're starting to potentially see some of those trickle down ramifications now of folks being very locked down to a single community, and maybe not being able to get out quite as much as they would like or should be able to. I would say that the caveat to that as well, though, is since most of Western Alaska still maintains a very subsistence-based lifestyle, that folks have still been out on the land, and I think that's great to see. I think that it's a very fine line of trying to stay protected, but maybe just don't have quite as many people in your fishing boat with you, for example. So I've been in and out of Anchorage and Fairbanks quite a bit over the last 10 or 11 months since the virus concerns really took off, and I think we've seen very big ebbs and flows. For example, in the more urban communities. And by that, I mean, I think we've seen everything from folks taking things very seriously to starting to get fatigue, as we're seeing elsewhere in the country. For example, I had to go to the grocery store a couple nights ago, and it wasn't that long ago that I would say upwards of 80-90% of people walking around a grocery store were wearing masks and being conscious of interacting with folks. And I think now we're starting to see still a majority of folks being cautious, but not quite to the same extent that I think we were seeing before. That being said, within the last 72 hours, we've seen new restrictions, or I guess renewed restrictions be put in place in Anchorage to try to stem some of the challenges. The largest military base in Alaska just declared a public health emergency as part of some of their concerns around the case counts that they're seeing with their personnel. So I think non-Indigenous communities as well are being concerned, but I think you're seeing far more lax compliance, I guess, for lack of a better way to phrase it, than what I've personally observed and experienced in Indigenous communities, particularly in rural Alaska. My personal relation with education is pretty minimal since I don't have kids and whatnot. But I think we've seen quite a transformation in the way education has been delivered, and I think one of the examples of that being, if we look at the Matsu Valley just north of Anchorage, many of their schools have started being in-person classes, even with maybe reduced class sizes, for example. But yet, as positive cases occur at the school, they end up having to restrict and close and whatnot. So it definitely seems like it's been I guess quite a challenge of trying to keep track of where different schools are at given times. The Anchorage School District was planning on going to in-person for some of the younger grades, and I believe that was supposed to start this past Monday, and they made a last-minute decision because of those extremely rising case counts to actually cancel those plans. So I think education is an example of where we're definitely seeing a lot of changes to how things have historically been done, but I think that also goes with, I think there may be some down the road ramifications that we haven't really gathered yet, and won't know what those are. I guess I'm thinking things along the lines of maybe an education gap for folks in school at the moment, for example, and Alaska with education, especially out west where there's a lot of turnover in teachers and school staff. I think that could be a very interesting thing to look at down the road. But education is not my area of expertise to make a lot of assessment on that. But it's definitely been an interesting change as far as how school's taking place right now. I know there has been quite a bit more attempts at online education out west. I think some of the perennial issue with that, though, is there's still a lot of areas of Western Alaska that don't have consistent internet. And so by saying we're going to go to online education, that might not be feasible in a lot of these communities. On top of, if you've got a small house with maybe children with 2 or 3 different grades all needing to do the same stuff, and not everyone's got their own computer or what have you. I think some of the logistics truly make online education in rural Alaska a particular challenge. It's not to say it's not being attempted. I know I've seen it in a few folks, or in a few villages, and talked with some close friends of mine that are kind of working through those paces. But it definitely doesn't sound like it's quite as straightforward as maybe it is in Anchorage or Fairbanks with folks trying to do the online stuff. I actually think that's a really interesting and dynamic question. We definitely have, like much of the Arctic, the challenges of we don't produce much of our food and products that we need day to day, and so supply chains are crucial to us. I can't say that I've really noticed a lot of differences in the urban areas outside of maybe there aren't quite as many products available, or the quantities you're used to seeing. I went to the store the other night and was going to get some steaks to have dinner with my parents that I hadn't seen in a while, and or you didn't have quite as many selections on on steaks that you wanted to get. So I think some of the little things like that. But I think the challenges in Western Alaska that revolve around logistics are frankly just being challenged even more right now. And I think, unfortunately for us, we had a litany of issues that really compounded that problem. So, for example, one of the main air carriers in Alaska went under late last year, early this year, and so a lot of the inter-village food travel that had to happen has been reduced. Unfortunately, that's just trickled down to make things a little more difficult in certain communities. We've also had, if we have supply chain issues in Anchorage or Fairbanks, those are obviously only going to be compounded in Western Alaska. So, I definitely noticed a few things on shelves in Bethel, for example, that were a little more bare than usual. I think as the pandemic has progressed, I think some of those challenges have been worked out a little bit more. For example, when I was in Bethel in the spring versus Bethel this fall, I think you saw fewer and fewer empty shelves. So I guess to me that's a good sign. But we also have just the perennial challenges. So for example, we've had two different fairly large villages that had their only grocery store burned down this fall, and totally unrelated from each other, totally different regions from each other. But nonetheless, when you have a community of 1,000 people and your only grocery store is burned down, that's a heck of a challenge, to say the least. So I think, and a problem like that happens any year. That doesn't necessarily make it COVID related, but I think you've got the supply chain challenges around COVID, and then you've got a grocery store burning down. Some of those problems compounding make things even more challenging. So I think we're going to have definitely some challenges this winter. I think on the plus side, when it comes to subsistence lifestyles, I think for the most part, from what I have gathered in my time in Western Alaska in the last few months, is that for the most part, a lot of communities did fairly well with their usual subsistence gathering. There were definitely some challenges in certain regions. So in Kotzebue, for example, one of the large caribou herds migrated very, very late compared to usual, and then ended up migrating in an area that was a little more difficult for villagers to access. And so I think, something like that, sure, not COVID related, but could be exasperating other issues that we see related to the pandemic. So I guess long story short, I think we're starting to see our supply chains kind of mellow out a little bit from how they were initially in early 2020. But I think we have a litany of issues right now that are all going to compound and make things particularly challenging for folks this winter. And I hope I'm proven wrong by that, but it's kind of just a gut feeling I have right now that we just have a few different things that we might be able to tackle one of them on their own just fine, but when you have all of them happening together, it makes it a bit more difficult. I do. Yeah. Unfortunately, due to some work that I do in public safety, I don't always have a lot of free time in the fall, but yeah, I definitely try to fish as much as I can. It's kind of a nice pastime for me. I didn't get to go hunting yet this year, but I'm trying to work it out to maybe go get a moose this winter, and which will be nice. I didn't get a moose last year just because I had to work so much, but yeah, I've never done a winter moose hunt, and so it might be my first one. We'll see how it goes. Definitely, hunting and fishing are pretty big for non-Indigenous folks, and in the urban areas of Alaska as well. So, we've currently got a very large caribou hunt that's open in the interior. The fishing is kind of quieting down a little bit now, but we've got a lot of opportunities, and luckily we've got a lot of folks that go to fill their freezers that way. This is purely going to be based on my personal observations on this, but I think particularly the elderly and youth are being challenged right now, and I think a lot of that is that while we might be, humans are social, and I think right now we've got a lot less social interaction than we're used to. In my own personal family, it means I haven't been able to go see my grandmother as much as I usually would. Instead of going every couple days to visit with her, maybe we're only going once a week, and instead of sitting around a dinner table, we're having dinner in the driveway, for example. So um, I definitely think that for the elderly and for young folks that are kind of on the spectrum of maybe just in their day-to-day life not having quite as much social interaction if they're not going to work, for example, um, I think they're definitely experiencing a pretty big uh, difference right now. I think for adults, I think as things are initially ticked off earlier this year, I have no doubt that most adults were experiencing some challenges with the increases in teleworking and things around that. But I think now we're starting to get more into where things have normalized a little bit. By no means are things normal, but a little bit. We're getting used to it a little bit more. That being said, we're also going into the winter, and unfortunately, that oftentimes means folks aren't getting out as much as they do in the summer, and very likely could mean that just being stuck inside, people get a little more stir crazy. But what I've been trying to get across to a lot of my friends is go for a walk, get out and do something just to get out of the house as much as you can. And but I think going into the winter, it's going to definitely add some challenges for a lot of Alaskans. So I think Alaska, like much of the Arctic, the way our healthcare delivery system is set up is very fragmented. By that I mean, if you're in a village in the Yukon-Kuskokwim area and you affected with COVID in a severe form, or break your leg, or anything particularly serious, they might be able to take you to Bethel and might be able to patch you up, but if it's really a serious issue, you're likely going to end up in Anchorage. And I think that's one of those things that a lot of folks outside of maybe an Alaskan context, or most of northern Arctic community context, maybe don't realize quite so much that we really don't have the ability to provide advanced medical care in much of the state. So for the most part, folks are always going to end up in maybe Fairbanks, but by and large in Anchorage if they have a serious medical issue. We also have had historical challenges with medical staffing, and so having advanced care providers, even in Anchorage or Fairbanks, in sufficient quantities that we're not burning our folks out, or but still trying to provide adequate care to the general populace. I think what we're seeing because of COVID is that by bringing everyone into Anchorage, we're having challenges with medevacs, for example. So we've only got so many aircraft that can really truly provide a medevac. And when we're dealing with a infectious respiratory virus, that there's a lot more precautions that go with a medevac like that. So I think we're definitely seeing strains there. I think we're seeing strains in Anchorage and Fairbanks with regards to the amount of ICU beds and ICU medical providers that are available to really care for those patients. So we definitely are seeing some major strains. Luckily, we have, for the most part, had one of the better survival rates in the country. And I think what that really goes to show is that while we have these very large per capita case counts right now, we are at least at the stage where we're able to treat those folks a little bit better, and try to help them the best we can. Unfortunately, that doesn't work all the time, but I think we're doing better than if we had really truly been hit very early on by very large numbers, by us having kind of had a delayed period initially with the virus. I think that helped us kind of get a lay of the land, prepare ourselves and prepare our systems a little bit. But we're definitely seeing some major strains. Interestingly enough, this morning there was a news article that came out that pretty much talked about how even if we have a 500 case count day reported, that's realistically probably quite a bit less than what it really truly is, because we have such a backlog in folks to go through the data and verify data and validate data or perform lab tests. And unfortunately, a lot of that I think goes back to Alaska being a small population. We will only have so many people that are trained and qualified to do some of that work, and so it definitely adds some challenges when we're trying to get a lay of how things are going. If we're ultimately just not able to do the legwork that we need to do in order to stay on top of it. Yeah, we've definitely seen some major challenges there. So, summer in Alaska is pretty aptly referred to as tourist season. We've got gobs and gobs of tourists every year, whether they be on cruise ships down in Southeast or riding the railroad in the interior or going to Denali National Park. So we always have tourists in the summer. This year was obviously very different from that. We still had some folks that traveled here and came to see the great things Alaska has to offer, but unfortunately, fewer tourists meant fewer tourism-related jobs. I think a lot of our local businesses, the smaller businesses, we've definitely had some folks, and I think more so in the spring when things were initially very challenging, that small businesses weren't doing quite so good and were experiencing a lot of challenges. But Alaska at heart, from being born and raised here, I feel comfortable saying this, Alaska is very big on supporting local small businesses. And so I think by and large, we've seen a lot of those small businesses really have a lot of support and kind of turn things around over the summer. And hopefully that continues here into the fall. So we've had a lot of takeout, breweries have a lot of takeout business. A lot of folks with the holidays have been, from what I've been seeing, have been doing a lot more local shopping instead of maybe going straight to Amazon. So I think we're trying to, help our neighbors as much as we can when it comes to, wage economy and wage employees. But, particularly the folks that were tied to tourism, I think really experienced a lot more challenge than pretty much any of our other sectors. I think most of the other sectors, food and, gifts and whatnot, I think a lot of those businesses were able to adapt a little bit, whereas tourism, I think by and large, there's only so much you can do for that. I think one of the cool things we saw though was that, as an Alaskan, there's a lot of things in the summer that maybe I avoided doing because it was always going to be so full of tourists. And so I think this summer we actually had a lot of Alaskans that were getting out and getting to see things that maybe they don't get to see very often, or going to Denali National Park in the summer, which is usually so full of tourists, it takes a lot of the fun out of it. So I think this year you had a lot more Alaskans going and being tourists around the state, which was really kind of cool to see. Um, I I think we need to look at that in a couple different ways. So I think from a statewide perspective, we had some very, I think, fairly structured and stringent expectations and restrictions around folks traveling into Alaska. And so I think that actually did help stem a lot of the case counts we might have been able to see with tourists or folks coming up from out of state to fish, or because again, fishing is another, commercial fishing is another sector where we do typically have a lot of folks traveling in and out of Alaska. So I think having a lot of those restrictions early on helped quite a bit. Fishing as an example, a lot of those communities that basically double, triple in size in the summer with fishing workers, a lot of them were very restricted, that fishing folks had to stay in their part of town and everyone else had the rest of town, kind of thing. So I think those types of measures really helped stem a lot of the influx of cases we might have had from outside of Alaska. On more of a local community level, I think it varies quite a bit. So I think, Anchorage typically, it's got half the state's population, so it's always going to be the biggest of anything in Alaska. So it's had the most cases throughout this whole experience. And it's hard to say. I think, Anchorage had some fairly strict restrictions. There's still some fairly stringent restrictions in place. It's hard to tell though, if how much of those actually go to play. And what I mean by that is that Anchorage is very close to the Matsu Valley, and the Matsu Valley doesn't have nearly as many restrictions, for example. And yet you have a lot of folks that commute daily for work between the valley and going into Anchorage. And so it's hard to tell if, just because there's restrictions in Anchorage, if when you've got folks that are maybe grocery shopping or going out to a bar in a nearby community and then commute into Anchorage, maybe they're not being the most cautious that they could be. So I think it's a very challenging thing to look at. And then on top of that, for more of a local level, I do think a lot of the measures in Western Alaska have really helped quite a bit. So very, very early on, we had villages both on the road system, off the road system, but in a rural context, that were very adamant that we don't want visitors coming to the village. We don't, if you're driving down the Alaska highway, don't stop here for gas unless you really, really have to, kind of thing. And I don't think folks interpreted that as being confrontational or anything. I think folks saw that it's their community. They've got the right to be a little more cautious if that's how they want to do things. And I think that really stemmed a lot of the cases that you might have seen in those really rural communities. And really, I think a lot of folks in rural Alaska were cognizant of we can't have major outbreaks. We have no way to treat an entire village if the entire village ends up coming down with a disease. And so I think a lot of those restrictions were actually pretty effective. Unfortunately, you're always going to have somebody slip through, but even to this day, if you land in Bethel or Nome or Kotzebue, the expectation when you get off the commercial jet from Anchorage is that you're going to get tested, or you have to have a negative test. And not everyone's complying with that, but I think by and large, you are seeing quite a decent amount of compliance. And I think that goes a long way to try to stem how much things spread, particularly in areas that don't really have the ability to treat large case counts. So in the hubs, and what I mean by the hubs, I mean the bigger regional communities, so Bethel, Nome, Kotzebue. My understanding is there is an expectation that you should be taking a test or have a negative test, but there's no, there's not a police officer standing there to make sure that every single person from the airplane gets in line to go get tested. And I would definitely say it's varied quite a bit. When I've been in Kotzebue, the vast majority of every plane is going and getting tested, or at least showing they have their negative test and following what the guidelines are. In some other hubs, it's not quite as effective, I would say, but they're trying to, in those areas, they're actually trying to incentivize quite a bit. So for example, Bethel started in, I think it was August, that if you either showed a negative test or got tested in Bethel at the airport there, you got entered into a cash drawing once a week. And so they're trying to just find a way to incentivize folks to comply with the expectations and, work with them as much as they can. And unfortunately, I don't think that was really, I think you're getting some folks, but you're still not getting everyone off every single jet. And whether, I'm not really sure the great workaround with that, but, luckily, typically when you've got folks coming out of the region to Western Alaska, it's not really a tourist destination. So folks aren't really mingling all that much. They're usually, if they don't live there, they're usually there for work and kind of keep a pretty small bubble. I would also say though, that in a lot of the villages that I've been in the last few months for work, a lot of them do have a very, very strict expectation that you will have your negative test or you won't come into the community. Due to the work that I do, we're considered essential workers. So, if we're coming into the community, we're able to come in but I can't even tell you how many times we would land in our plane or land in a boat in a village, and gosh, before I could even get off the boat, I had a handful of people that would come and check and make sure that, hey, you've got your negative test, or are you going to quarantine, or, what can we do to make this a very short visit in the village so that you can, move things along. And a lot of these are villages I have a lot of uh, experience with, relationships with folks, and I can honestly say I don't think any of it is meant to be a negative thing. I think that folks are being cautious, and I think it could come off as being confrontational when they're saying, "Hey, we don't want you here right now," but I don't think that many people are interpreting it that way. And luckily, a lot of these communities, most of those folks they're going to bump into like that are going to be coming from another village, for example. There aren't going to be that many people, maybe in my case, maybe non-Indigenous who are coming into Western Alaska just to stop and visit, for example. So, um, yeah, I would definitely say so. I can think of an example in October in the Northwest Arctic Borough where we stopped. We needed to get gas. We were um, you know kind of getting to the point where we really really needed gas, and you know, we landed the boat. I called ahead, talked to the folks with the gas station. We had a whole plan figured out. But then even walking up with my gas can, we still had folks that would walk across the street and walk down the other side of the road, and it was kind of different because from most of my experience, you usually have folks that are very very friendly and want to stop and talk to you, and I don't think we're not having that quite as much as usual right now, and I don't think that's necessarily a bad thing, but it's definitely a very different experience when you're used to stopping in a community to get gas and everybody and their brother wants to come down and say hi and hear what the latest gossip is and all the rest of it. And right now I don't think you're seeing that quite as much. Um, and when I talk to some of my friends in a few of the villages in the YK region, as an example, I think folks are kind of getting a little stir crazy because that was always one of the ways that they would, hear what's going on in Bethel or hear what's going on in Anchorage, maybe. And since people aren't really stopping to talk as much, you know, people are getting a little frustrated and cabin fever, I think, right now. Um, I don't I don't know that I would. I think the challenge is always going to be that, particularly on the road system in Alaska, uh, Alaskans are historically very independent-minded folks, and so it's difficult when you have the government or public health saying, "Hey, here's what you should do for the greater good," essentially. And I don't think necessarily the measures are the issue. I think it's more so the trying to get folks to comply with those requests. And I know that throughout the U.S., there's been that's kind of been a typical perennial discussion throughout this experience. So I don't know that the measures are really the challenge, but when I think of Western Alaska, just because you live in a village on the Kuskokwim River or the Yukon River, uh, occasionally you're still going to have to come to Anchorage, whether it be grocery shopping or a doctor's appointment. Um, to me that's essential travel. So you need to take care of those life things. But by you coming to Anchorage, you might be used to a very restricted and conscientious community perspective, but then you come to the big city and folks aren't being quite as careful. So even with the measures in place, so it's very difficult for me to say that we need more stringent measures, but I think if there was a way to kind of push folks into better compliance and maybe better understanding of these challenges, I think that would go a long way. But I I don't know how to I don't know how to do that part. Absolutely. So just like much of the Arctic, um, the 1918 Spanish flu pandemic is still ripe on a lot of folks' minds. There might only be a couple elders still around who personally, were alive during that, but there's friends of mine who are elders in their communities whose parents, for example, maybe perished, or uncles or aunts, and so it might be one generation off, but I think it's still a very real, and very much alive in many of the indigenous communities that are in Alaska. I think that's actually fueled a lot of the lessons that have been applied throughout this experience. So with communities very, very early on, limiting access to outsiders, some of those actions that we really didn't see happen on a bigger scale very quickly. I think we saw I think they got stood up very quickly in a lot of the villages in Alaska. And my gut feeling is that a lot of that is due to that generational understanding and the history that we've had with pandemics in particularly indigenous communities in Alaska. So I definitely have no doubt that it's fueled a lot of what has guided things this time around. Unfortunately, there's only so many folks that were around in 1918, and so I think the information that's been passed on from that experience, I think, has been far more alive and guiding to many of those rural indigenous communities than maybe it is in a place like Anchorage or Fairbanks that maybe doesn't have that generational storytelling background to continue that live history. Man, if I was king for a day, I guess. Um, well, I think my guidance as someone with some training and experience with public health is that, pandemics are real. This isn't the first time mankind has gone through a pandemic, and it certainly won't be the last time. And so I think by and large, having a strong understanding of, what it takes to address and limit something like this is really big. And I think in a place like Alaska and much of the Arctic, trying to bear in mind just the true logistical challenges that we have every single day, and how those challenges can be increased really just in light of a challenge like this. And like I mentioned earlier with food delivery and supplies, the fact that we had a pandemic on top of grocery stores burning down, on top of supply chain issues, and on top of a major air carrier ceasing operations, really, I think we could handle any one of those things on their own because we're very resilient people. But when you start to get a lot of those things together, things get very, very challenging. And so I think preparation and being mindful of potential future challenges is really one of those big things that is important to me, and I try to put onto other folks. But I think it's important for future generations to look back at this experience and recognize the challenges we went through, but then to learn from it and realize that they very likely could go through something similar, and realistically something more serious and deadly than we're experiencing, and need to be prepared to handle that in a very data and scientific driven way. And I think that's one of the key things, is that by and large a lot of what we're experiencing is data driven and driven by true observations, and using that information as the guiding backbone, I think, is really the key component that needs to be used for future direction.